All right. Good afternoon, everyone. Welcome. I see folks are joining, so we're going to give it a couple of minutes. Let people get logged in. Welcome. Hope the weather's great for everyone. Beautiful here in Memphis. Welcome. It's letting folks arrive. Maybe one more minute. It's only 12:01. And say hello in the chat if you like, so we can see who's here with us. See some familiar names. Hey, Deborah Hester, thanks for being with us. Carol Gregory, welcome. Cheryl Marsh, good to see you. Kathleen from THDA, welcome. Hey, Mary Shearer, good to see you, my friend. Bill Trammell, welcome. Hey, Nancy Azzarolo. Tania Moore, welcome. Awesome. So happy to see all of you here. We're at 12:02, maybe 30 more seconds. Miss Belinda Campbell, welcome. Nice to see you there. Judith. Courtney Tull, welcome. Okay. So we want to be respectful of people's time, so I think perhaps I should get started. Welcome, Jackson County Habitat in Georgia. Hey, Michelle from NPI. Welcome. Thank y'all. So I am Duane Spencer. I'm the president and CEO of Habitat for Humanity of Greater Memphis. And you all know Habitat for helping families build and buy new homes with affordable mortgages. And we've been doing that for 38 years now. So we're coming up on our 40th anniversary. So we're excited about that. And then 7 years ago, we started doing something called Aging in Place. I know many people are becoming more and more familiar with that, where we are working with older homeowners to do critical repairs and mobility modifications. And we've probably done about 1,100 of those in our service area. Also very proud of that work. We also pride ourselves on being innovators. And we try to bring people together to talk about various social issues around housing. And we try to be comprehensive and holistic in that effort to bring about positive change in people's lives. And so when we started thinking about relaunching our Women Build program, we really wanted to do it a little differently than we had in the past. This is my 20th year with the affiliate, and we've done tried a lot of different strategies. And this time we just thought, we're not going to start off by trying to raise money. This time we're going to start off raising awareness first. And we decided to focus on issues and hardships that affect women and girls internationally, nationally, and right here in Memphis. And so we want to address some of the things that impede a woman's ability or girl's ability to thrive and to enjoy stability, and anything that gets in the way of them building generational wealth through empowerment and homeownership, which is what we're all about. So today's conversation will look at housing, health, and gender equality, and it'll be moderated by our own Chris Reeder Young. So Chris is an applied anthropologist, and she's worked with all of us here at Memphis Habitat for 11 years as our senior research and evaluation manager. And Chris has been truly instrumental in helping our affiliate determine the important data and research methods that are helping us better understand the real impact of our work socially and economically. So Chris, I'm going to turn things right on over to you.
Thank you so much, Duane. I appreciate the introduction. As Duane mentioned, Habitat has been supporting social determinants of health for almost 40 years. And we do that by providing first-time affordable home ownership to families and by offering critical home repairs to senior citizens who are aging in place in Memphis. And we all know that things like healthcare and going to the doctor is significant in health outcomes. But a person's environment is just as significant for influencing their health and their well-being outcomes. In fact, over 60% of our daily well-being comes from things like where we live, our zip codes, our communities, the housing wages we get, how affordable our homes are, and even things like access to clean water, human rights, and property rights. So globally and locally, individuals who identify as female experience significant disproportionate outcomes related to environmental and housing access. And honestly, trying to create solutions to that can be really daunting. So in order to address some of the unjust disparities that we're seeing, not just locally, but throughout the United States and globally, we've invited two brilliant minds who will be elevating our understanding on these topics. So I would like to welcome our speakers, Dr. Kendra Hotz. She is the Robert R. Waller Chair of Population Health and the Director of the Rhodes College Equity Program. Her expertise is in theology, ethics, Africana studies, and urban studies. And secondly, I'd like to welcome Dr. John Akudago. He's the Global Director at Habitat for Humanity International as part of the International Shelter Initiative. And his expertise is in WASH, which stands for Water, Sanitation, and Hygiene. And something new that I learned is a hydrogeological background and environmental and science. And those are two things that significantly impact health. So I would encourage everyone to read their full bios on our website because it's truly inspiring and it will help us kind of frame things moving forward in our conversation. So Dr. Hotz, I would like to invite you to share your screen and to teach us more about some of the local and national experiences that women and girls face as it relates to environment.
Thank you. I am so grateful to be here today and grateful for the work that Habitat is doing. What I want to do is help you understand some of the basic biology that transforms social inequalities into health disparities. And we're going to be thinking about housing as one of the most fundamental components of building stability and welfare that will translate downstream into differences in things like outcomes for diabetes and hypertension, stroke, and even infant mortality. So this is just going to be a basic introduction to health disparities. Let's start by thinking about what social determinants of health are and how they affect health. So what we're looking at here is neighborhood as a social determinant of health. So which neighborhood you live in. And in this case, the determinant is simply life expectancy. So how long can you expect to live? It will also affect quality of life, but right now we're just quantifying years of life. This is data that comes from the Shelby County Health Department, and along the x-axis, you're looking at two different zip codes within Shelby County. 38106 is the area around Soulsville, and 38017 is the area in one of our farthest eastern suburbs, Collierville. What you're seeing here is a 13-year life expectancy gap between those two zip codes. And if you were to come to Memphis and ride your bike from Soulsville to Collierville, I'm telling you to ride your bike and not drive your car, because a car is going to put you on a major interstate where you can't see anything at all. That's a whole separate story about social determinants of health. But let's take those residential roadways, the 26 miles between Soulsville and Collierville. You gain a half a year of life expectancy for every 1 mile that you move to the east. And you can think about some of the things that change over the course of those 26 miles. The quality of the housing stock, the availability of green spaces, the transportation infrastructure, availability of nutritious foods, and even access to primary health care. You can get easily to an emergency department from 38106. It's right across the street, but you can't get into a primary care facility unless you have the right kind of insurance. And that means people end up delaying health care until it becomes an emergency. And that's a much more difficult way of managing health. Second social determinant of health that we're looking at here is socioeconomic status. So this, of course, is very closely related to neighborhood. What you're looking at along the x-axis is household income, and along the y-axis, you're seeing prevalence of type 2 diabetes. So you see this perfect stair-stepping. For every increase in household wealth, you're seeing a decrease in prevalence of type 2 diabetes. This is called a health-wealth gradient, and you could make a very similar chart like this for nearly any chronic disease that you can name, from hypertension and stroke to asthma and, in this case, type 2 diabetes. These tests, these health wealth gradients, have been conducted consistently since they began in England in Whitehall in 1968, and they've been replicated hundreds of times in dozens of locations, and they always come up with this same result. The more you increase household economic stability, the more you decrease prevalence of chronic diseases. Here's a third social determinant of health: racialized identity and education. Please notice I'm not saying race. This is an important distinction. Race is not biologically real. It's socially and politically real. So race isn't something you are. It's a way in which you are read by other people, a way in which you are legible to them. So I'm going to be talking about racialized identity as a way of reminding us not to confuse what we can see with our eyes with what's under the skin. So we're looking at infant mortality here, and this is a confusing chart. I apologize for that. I'm going to try to just break it down to the simplest components. See that dark blue line on the far left of each cluster? That's the infant mortality rate for white women. And you see on the far left cluster, women who have dropped out of high school. Then next to that, women who have completed high school, women who have some college, and on the far right, women who have completed college. And what you see is a health wealth gradient among white women, that the more educated you are, the lower your risk of infant mortality. Then look at the orange line just next to that dark blue line. Now we're looking at infant mortality rates for African American women. And you see that internal to African American communities, you also have a health wealth gradient. We could call this an education health gradient, but since education is so closely tied to wealth, I'm just going to stick with the one that rhymes, health wealth gradient. Now, here's what, this is disturbing for many, many reasons. The first is that you see that African American women have astronomically higher rates of infant mortality than white women do. What's even more disturbing is that if you'll take a look at that white woman who dropped out of high school, you'll see that her infant has only a marginally better chance of surviving its first year of life than the African American woman whose child, who completed college. And I think there's a temptation here to say, gosh, that's got to be a biological difference. Surely there is some, genetic difference that explains this. But in fact, it is a social difference. If you gather infant mortality data about African women who immigrate to the United States, so women who were born and reared on the African continent, you will find that their infant mortality rates look just like their white peers based on education. But the daughters of those women from Africa who are born and raised here in the United States have infant mortality rates that mirror their African American peers. And what that means is that the thing driving those infant mortality rates has to do with the social context of being legible as Black in the United States. In just a minute, I'll explain to you why that's true and what that has to do with housing, both for Black women and white women. So first, we need just a minute to think about a temptation that we have, especially here in the US. We tend to attribute causality to individual choices. If something good happens, we want to know who made the good choice, who did the right thing, whom should we be praising? And if something goes wrong, we want to say, well, who did the stupid thing? Who made the mistake? Whom should we be blaming? And I call this agency bias, a tendency to ascribe to the agent rather than to the structure, the causes of good and bad things. We can also call it the myth of meritocracy. And here I've just chosen a meme, and I hope it's clear that this meme is something I intend to say is false. The meme says, your life is the result of the choices you make. If you don't like your life, start making better choices. And we like to share these things on social media and affirm to ourselves that if my life is going well, it must be because I did something right. And if my life is going poorly, it must be because I did something wrong. What's really destructive about this myth is not simply that it's false, but that it also creates in us a reluctance to be compassionate toward people who are suffering, a temptation to say that if your house is in poor repair, if you can't afford to live in a better neighborhood, you must not have made very good choices with your life. And so why should you deserve help from me? In fact, what I want to show you about health disparities tells you how very, very deeply structural explanations go, so that I think we're best to suspend questions about blame and praise for individuals. So another way of putting this, you'll recognize this as the Ever Given, that ship that was blocking the Suez Canal, is that we have these enormous structural problems, and we tend to want to fix them by changing personal choices. That little digger helped. It definitely helped to get that ship unstuck, but it took the tidal force, the planetary gravity of the moon, to raise the tide and float that ship. We need to start thinking in terms of the planetary gravitational forces and less in terms of the individual choices. All right, now what's this got to do with housing? Let me give you a very brief explanation of why social differences become health disparities, including differences in the kinds of homes we live in and in how good of repair they are in. So first of all, adversity and toxic stress. You need to think about the context in which our bodies evolved. We evolved to survive a context in which the big threat to our well-being was a predator. And so anytime we feel out of control, anytime we feel that something might be a threat to us, our bodies respond as though what we need to do is fight or flee from a predator like a lion or a bear. The thing about lions and bears is that the threat is acute and episodic. You experience it right now and you either survive it or you don't. And whether you survive or not, your stress levels go down. When you feel stressed, your body produces this stress hormone called cortisol, and it works magic if what you need to do is get away from a bear. It elevates your heart rate so that you can run really fast. It, oxygenate blood more efficiently. It releases a coagulating agent into your blood called fibrinogen, so that if you're injured, you don't bleed to death. And it slows down the rate of that you use up blood sugars so that you have a ready source of energy. But the stresses of poverty and racism aren't acute and episodic. They are chronic and systemic. If your cortisol level stays high, we call that a heightened allostatic load. If your allostatic load stays high because you're suffering systemic stressors, then think about it. That elevated heart rate is going to be associated with things like hypertension and cardiac disease. The fibrinogen in the blood system will produce greater clotting and you will suffer strokes. Memphis is the stroke capital of the United States. The slowed response to blood sugars over time will become type 2 diabetes. And finally, this is our link to infant mortality, that sense of being out of control that raises your cortisol level. Cortisol is also the hormone that prompts uterine contractions. And so someone who is chronically and systemically stressed is predisposed to have premature contractions and to give birth prematurely. And that, of course, is our top predictor of infant mortality. So what you're seeing is that conditions like poor housing are producing a sense that we lack control in our lives, and that sense downstream is producing these health disparities. Very briefly, because I have just a couple minutes left, weathering and the life course perspective. That heightened allostatic load is aggravating to your body. It produces a lot of inflammation, and inflammation damages us at the cellular level. In fact, inflammation, and you can measure that with markers like C-reactive proteins, that will actually wear down the telomeres, which are those little protective caps on the end of your chromosomes. This explains why people age differently. Some 65-year-olds can still run a marathon. Others have trouble making their way across the room. That's largely the effect of weathering, which is to say your body is aging faster because of those chronic and systemic stresses. So not only are you getting particular diseases like diabetes, but you're also aging faster and suffering a wide range of disease conditions associated with old age and frailty. Finally, very briefly, and this is directly related to housing, biological embedding. Feeling acutely unsafe during childhood can produce what we call an adverse childhood experience. Those ACEs will trigger an epigenetic effect, which simply means that some genes turn on and some turns off. And what that does is tell your body, get ready to stay in a permanent state of stress. So that even after that, if your life is relatively easy, your body will still have a kind of hair trigger fight or flight response. And that means you might be predisposed to these diseases that we've just been discussing. All of these are related to housing because one of the most basic things we need to feel secure, to feel safe, to tell our brains that you can calm down, it's okay, there's not a bear chasing you, to lower the level of cortisol in your body is a safe place to be. A home, something that is lovely and welcoming and safe. That downstream will change our health outcomes in really dramatic ways.
Dr. Hotz, thank you so much. I feel like you greatly painted the image and the landscape of the cellular level of what it looks like to be stressed out and how that impacts your kind of chronic long-term health. And then paint some images of things that we can expect to actually address some of these things. So I appreciate that. If anyone has any questions, please drop them in the chat box. We're going to get to questions for both of our speakers today at the end of Dr. John's presentation. Would you like to go ahead and share your screen, Dr. Akudago? There we go. Please go ahead and share with us some of the global impacts related to housing and environmental conditions and the outcomes we can expect with health.
Thank you so much, Dr. Hotz, for the explanation to us. You've really given an introduction to what I'm going to talk already. So I think you did much of my job already. Thank you so much. As we are all hearing today, the house is an important place. It's where we live, it's where we grow, and it's where we get educated. So, and the one who does this mostly is the woman. The woman takes care of the children more than the men, especially when you go internationally. So I'm going to share a little bit of what the house means to a woman and how that is actually impacting development and why we are linking this to water and sanitation. So globally, about 1.2 billion people are living in substandard housing. And as we've heard this morning, when a house is not adequate for you to live, there are so many things that could happen to you. You could fall out of that house, you could fall sick, you could, so many things can happen to you, and we'll be looking at that as we move. And apart from just the 1.2 billion people who are living in substandard housing, 32% of the world's urban population are living in slums. When we talk about slums, they are areas that are informal. They are not planned from day one by the government, so no access routes are available. From somebody's bedroom, you can enter another person's bathroom, and from another person's bathroom, you may be entering another person's dining room or something. So very informal. They don't have access to services, and conditions are just too poor to live there. And so when you talk about housing in the informal sector, it is even another complication because people are not having it, but in that area, it is worse because services are not even available. Now, when you talk about a house to be adequate, we are talking about a house that has a roof over your head, a house that you feel secure, that nobody is going to take you out of that house because you don't own that house or you don't have a legal agreement between you and the tenant, the landlord or somebody. It is also culturally adequate. You want to make sure that the house is something that is designed within the cultural context that people fit into it. Earlier on, we were just sharing a joke about the location of houses at some points. There are some communities that when you go, the location of the house is in an area where you wonder how the people are even able to climb up to that place or even able to live there for just 4 hours. It must be accessible. We know that it's not everybody who has the ability to get to somewhere. So access in terms of being able or disabled, and access in terms of being able to drive into that place or walk into that place or whichever means of transport you are talking about. And then habitability. We want to make sure that the house is also in an environment where people will feel comfortable to live. They are not competing with other dangerous animals that may come and cause problems, or they are not under threat of climate, issues, or maybe flooding or disaster or fire or anything. It must be a place which is considered safe to live. And then it must be affordable. When you want to have a house, you want to have a house that you can pay for, that you can build, that you can construct. So if the house is more than what you can afford, that is definitely a big issue. But of all these, one important thing that when you get into the house, you live with forever is access to basic services. And I don't know if you've ever traveled in a bus where you feel like stopping to just use the restroom and you don't have any access. That is a situation in a house where you live and there's no access to basic services like water, sanitation, and hygiene. So I've already told you in the developing countries, most men and women live together as couples, but their responsibilities are gender-based. And so if the woman spends more time living in the house and access to basic services is not there, how does it impact the well-being and welfare of the woman? So we'll be looking at that in our few slides. So as you can see here, there are 3 photos that I have here. From the right, you have somebody standing to wash hands. And then the middle, you have a toilet. And then on the left side, somebody is sewing something. That is menstrual hygiene part. Now, the reason why we put these photos is just to clearly define what water, sanitation, and hygiene services mean to you or mean to me in the house. Definitely, we need water to cook. Every day, it is expected that even if you don't drink water, you should drink 3 liters of water every day. I don't know how many of us practice that, but that is supposed to be something minimum. If you don't do even like drinking water, you need to try and drink. But if you don't have access to water, how do you even get 1 liter to drink, not to talk about 3 liters? And then again, the middle part is a toilet. In many houses, you might find houses constructed in developing countries and the toilet is 500 meters away. So can you imagine in the middle of the night, no electricity? Safety is a big concern. Snakes are moving around. You are interested in using the washroom. You have to wake up and walk 400 meters or 500 meters to that toilet to access. That alone is a little bit of a safety concern to anybody that is living in that house. And then also hygiene issues are really, really important. Everybody knows what it takes to appear in public. You don't want to appear in public and somebody says your hygiene is very poor. And what even adds to the whole hygiene issue is menstrual hygiene. Women of reproductive age or adolescent girls go through this naturally. And having access to water and sanitation services is very key to them. And again, I'll be explaining more on that in the subsequent ones. Now, the difference between developed and developing world is, in the developed world, you have the house, which is already designed, and all you need to do is to put it on the ground, on the piece of land that you have, and just fit to all the services that are already available. You can access the water through the city and then just connect and you start paying. Or maybe the gas is flowing to the place there through the gas company and you just pay. Wastewater is not a problem. In the developed world, the house can be located in town A, and then the source of water for you to drink is in town B, which is about 7 miles or 5 miles away from your home. So the question is, if you live in that house, how do you manage your menstrual hygiene issues? To address this, Habitat has been building homes. We know the importance of having a home, and we know that a home cannot be adequate without access to water and sanitation services. So as a result of that, we have incorporated WASH programming, which is water, sanitation, and hygiene programming, into our housing programs. And we are currently in about 30 countries. And as you can see from the maps, they are dotted all over the world. And so we are working internationally to address the need for water and sanitation in those places or communities that we work in. Now, this is what is going to explain more about the relationship between women or gender in general, and then WASH services. If you look at the top left, that photo is from India. In many areas in India, getting space to even construct a toilet is a problem. But this is a natural process everybody must attend to. So what we are doing there is we try to construct sanitation complexes where we try to construct a couple of story buildings. And then you have the first floor given to the ladies where they can have their toilets and their baths. And then at least to make sure that everything is safe, they are at a place where everybody can see them. And then the top is given to the men, where they can also go up there to use the facilities whenever they need. And as a result of this, we create employment for people who will be managing this. And sometimes it's not easy to find the land, so you get the third floor, which you would house those whose land has been taken away from them. So this is actually addressing a big need in terms of making sure that women are safe to attend to nature's call whenever they need to go. And at the same time, it is creating a livelihood project or program for the women who are looking or taking care of these facilities in the Indian communities that we have this. Again, when you look at the top left, right, that is a water kiosk installed in Zambia. Women would go there and access this water for a fee. Somebody is sitting in the kiosk and collecting the money and making sure that that money is sent to the bank for keep. And then when there is anything that is broken in that shop, the money would be used to repair. Now, as a result of committing her time, mostly it's a lady who's there, her time to doing this, she also gets paid from it. So that is a way of creating livelihood for somebody who probably wouldn't have gotten a job to do if she was not doing that. The bottom part that you can see is a water closet, toilet, and then WC, and then a wash sink. We were all told to wash our hands during Corona, and we are still ongoing. So you have to keep on washing your hands. So if you don't have a place to wash your hand, it is definitely a big issue for you, especially when they say shelter in place, do not go out, lockdown. There is no toilet to go. And even if you get a toilet to go, how do you wash your hands? So it is very important to know that water and sanitation plays a big role in combating especially infectious diseases like Corona that we've just had, Ebola that we had a couple of years ago, cholera, which is a global issue every year. They are all part of the things that we need to take proper hygiene before we can combat them. Typhoid, many of you who have traveled out of the US, typhoid is also an issue, and we need to make sure we deal with it so that we don't fall sick. The last one, which is at the bottom, the photo, talks about the importance of WASH in women empowerment and girls empowerment. One of the challenges that you have culturally, and I was very keen in listening to Dr. Hotz' presentation, is that girls drop out of school, especially in developing countries, just because there is no water in the school and there's no sanitation facility where they will feel safe to go in and manage their menstrual hygiene issues when it is their monthly time. So when you don't have that, the girls definitely drop out of school. And when they drop out of school, already everybody is fighting or competing for the same employment at a given period of time. And the people present their qualifications, present their experiences, and so on. These are girls who have not attained anywhere because they dropped out of school just because there was no water in the school. How are they going to compete with their male counterparts in the future? So at the end of the day, not having water in a school simply means we are disempowering the young girls that are living in that community. We are exposing them to other challenges that they probably didn't call for them. And then at the end of the day, these women would always be left behind. So if we want to talk about equality, equity, or doing everything to make sure we end poverty, we cannot end poverty when we don't have everybody having equal opportunity to grow and pursue what they have to do. So when you look at all this, it is clear that there's a lot that we need to do, and water and sanitation is really key. If you look at even the house again, to feed maybe infants with, let's say, baby formula, they need clean water to do that. How do you manage? Maybe most men would travel out of their homes and migrate to other places to look for a job. It is the woman who goes through all this stress to manage the house. So women are directly impacted when there is no access to water and sanitation services. As you can see here, this is just a case study from Malawi, where we are working with the schools to help improve girls' enrollment and staying in school. Because once you don't have toilets and a safe place for them, where we call a change room for them to manage their menstrual hygiene issues, they are definitely going to leave the school. Even if you enroll them at the early stage, they will drop out of school. So this is just an example of what Habitat is doing. There are many areas where we are working. We are working in Cote d'Ivoire, we are working in Zambia, we are working in Malawi, Ethiopia, Brazil, and other places, as I've already shown in the map. But in Malawi, we are specifically working to make sure that we are empowering these young girls to know what to do, especially managing their menstrual hygiene. And you can see at the bottom part, the girls are taught to make their own menstrual hygiene pads. And these can even be transferred to the communities where they live and so on. And once you teach people in school about hygiene issues, about water and sanitation challenges, and then the need for it, and how to live healthy with access to these services, they also carry this knowledge and get home and talk to their mothers or their parents in general and their siblings. So this is what exactly Habitat is doing in many communities, trying to make sure we empower the women, empower the young girls to also have a better future going forward. So I would stop here. I'm sure there will be questions, and then I can clarify wherever there's the need. Thank you very much.
Thank you so much, Dr. Akudago. I'm just blown away by the landscapes that you're both painting, not just through statistics, but narratives and stories, and then providing some solutions to some of these, again, really daunting issues. I greatly appreciate, again, that you shared on concepts, indigenous property rights, access to water, because whether it's a global issue or a regional issue, I think that we can all understand that access to water and having individuals who are fairly and justly represented as for those property rights is significant. And I heard Dr. Hotz mention the kind of chronic and long-term health outcomes such as stroke, which started with something as simple as having an affordable or accessible home. And I heard Dr. Akudago mention, the implications of surging communicable diseases, Ebola, typhoid, things like that, as a result of water and those limitations. So I have a couple of questions, but I wanted to pose to our audience members. Anyone who would like to drop some questions in the chat box, go ahead and do that. Our staff at Habitat will be sending those questions to me, so I make sure that I ask them. So far, it doesn't look like we have any questions in the chat box. So I was going to kick it back to Dr. Hotz. And if you wouldn't mind just turning on your camera. Kendra, could you tell us some more about what type of health issues may come from lack of affordable housing, lack of accessible housing, let's say for a senior citizen who doesn't have, let's say grab bars or possibly a ramp to get in their home. And you can absolutely give some examples of how this impacts children as well. What are some conditions that you have researched that are tied to housing instability and challenges like that?
So one of the most obvious ones right now in the midst of the pandemic is infectious diseases. We found if you take a map of Memphis that was redlined in the 1930s, which would have showed our lowest income neighborhoods, but also our minority neighborhoods, because when we redlined, what we said is these areas are ineligible for investment, right? Public investment, private investment. African-American neighborhoods were also redlined even when they were relatively affluent. What that did was suppress property values, and it made it very difficult for those neighborhoods to avoid falling into a sort of downward spiral. Now, if you take that redlined map of Memphis from the 1930s and you overlay it with our current map of conditions like asthma, diabetes, so forth, they're a perfect match. But you can also take our highest rates of COVID infections and find that those also perfectly match. And there's a perfectly clear explanation for that. So if you think about, go back to running away from the bear, right? You don't want to get sleepy just because it's dark outside when your life is imminently threatened. And so one of the things cortisol does is disrupt circadian rhythms. Disrupted circadian rhythms suppress immune function. The body moves energy from one kind of survival, long-term survival, to a different kind, short-term. And so when you have populations living in these kinds of stressful situations, they're going to become more sort of susceptible to infectious diseases. Here's where the housing issue comes into effect. When you have dense housing conditions, when you have multiple families sharing the same home, when you have too many children sharing the same room, you're going to get closer proximity. Also, you're going to get the population that's serving as our essential workers and aren't able to practice good social distancing. So they're going to bring that home. Those housing dense situations are going to bring an infectious disease to a population that's already more susceptible to it. So things like COVID-19 and other infectious diseases are another place where you're going to see a strong correlation between housing, particularly housing density, and disease rates.
Thank you so much. And I think that paints a multi-generational impact as well, because folks who are living in high dense areas are probably multi-generation sharing those spaces, and that can be quite a challenge as well. And what we've also found in our research at the Memphis affiliate is that a redlining map and a subprime lending map are very similar. Subprime lending has chronic and long-term impacts to health as well. And that's, still an issue in a lot of places in the United States. So we have a question in the chat. Nancy asks, are these water and hygiene issues found in the United States or only in underdeveloped countries? So Dr. Akudago, if you want to tap into that question, Dr. Hotz, it's really a question for both of you.
Okay. Dr. Hotz, do you want me to go forward? Okay. So what is happening is water and sanitation is actually a global issue. A couple of years back when we had the Millennium Development Goals, they thought many of the challenges that the developing world faced was only in the developing world. But right now we are beginning to see that that is not wholly true. Water and sanitation challenges exist a lot in the US. For example, if you look at the native Indian reservations during the Corona crisis, 30% of the population here do not have access to water and sanitation. That is very strange to anybody who is hearing this, but it is a reality. If you look at even the water that we access, and I'm sure there have been examples that we've seen from the Flint water crisis and so on. It is not all about just having the water in quantity. Water exists in quality. And when the quality is not what you should consume, you don't say you have access to that service, because water can be something that will help you fight infectious disease. It can also be something that will bring disease to you. So water quality is becoming a problem due to industrialization. And I think this is actually a big issue globally and not only the developing world. Thank you.
Yeah, I appreciate that. It's a topic I know a lot about, but I can just highlight a couple of things that I think bring this water quality issue home to the US. So the first is everybody knows about Flint, Michigan, right? When you think about where are we most likely to find aging water lines, inadequate access to fresh water, lead problems, they're most likely to be in our communities of color. So that's the first thing. The second, when we think about access to water, we have to remember that we do have an unsheltered population in the US. And while people become very upset with homeless people relieving themselves in public spaces, when you don't have access to a restroom, you know, bodily needs don't just stop. And so we need to think about the unsheltered population as well. And then finally, one of the issues we find here in Memphis is that we have more EPA Superfund sites than anywhere in the US. We have 173. So these are the sites that the Environmental Protection Agency has identified as most placing human health at risk and in need of being cleaned up. We have more of those than anywhere else in the US. That's the result of what we call environmental racism, which means that we tend to put our toxins in communities of color, and that's more predictive of where we put our toxins than low income is. So in other words, a low income white community is less likely to be exposed to a toxin than a middle class Black community is. A good example of that is the Memphis Depot, which is down near the airport here in Memphis. If you look at a demographic map of the area surrounding it, it's 95% African American. It's a munitions depot from after the Second World War, and it's leaching heavy metals into the ground and into the groundwater in that South Memphis neighborhood. So we do see similar kinds of patterns globally and in the United States.
Kendra, thank you so much. As is the Memphis Habitat way, I usually start to approach kind of a solutions-based discussion once we start to kind of close out our conversation. Now, we've tapped on a lot of different things. We have a lot of folks in the audience who are already Memphis folks and some folks who are also Habitat folks. So we're kind of built into some solutions already. I'm wondering kind of what general advice you might have for the folks who are attending today. Maybe it could be, you know, educating oneself about aspects around environmental racism, aspects about, you know, access to water, concepts around patriarchal values and how that impacts women and girls' health, racism. So I guess what I'm asking for is what are some kind of advice and pieces of advice you could give individuals who have attended our webinar today?
I'll kick this one off and then hand it over to Dr. Akudago. A couple of things I can think of that align pretty well with Habitat values and commitments. So the first is start being really attentive to what's going on with your land use control board. Pay attention to where are the proposals for landfills. They very typically, it's not uncommon to find landfill proposals near elementary schools in Memphis. So pay attention to your land use control board, what's going on there. Pay attention to the place where your city council is granting pilots. So payment in lieu of taxes to major real estate developers, because those are, if they're not deliberately designed to provide affordable housing, to provide living wage jobs, those are washing away, eroding our tax base that allows us to provide better city services. And then finally, housing is intimately connected to transportation. So pay attention to what's going on with your local public transportation system and see if there aren't ways that you can support more robust transit. Because if people can get to stable employment, then they can afford upkeep on homes. As we begin to improve housing, we begin to improve those downstream health consequences. And transportation is one of those hidden threads that we often don't pay attention to when we're thinking about how all of the social determinants come together.
Thank you, Dr. Hotz. Yes, I perfectly agree with you, especially when it comes to waste management. One thing is that as a water person, my understanding is that even sometimes where the waste is generated is not those people who actually suffer from the consequence, because water is a moving thing. It keeps moving in the ground. And so when you contaminate an area, it takes a long time for those downstream to realize that it has reached them. And by the time it has reached them, cleaning it is very difficult to do. And most of the time, maybe government officials, whether in developing country or wherever you are dealing with, they just look at the immediate benefit without making costs benefit analysis to see in the long term, how much am I going to spend versus what I'm going to get now. And because they are always looking for opportunities to get people employed, they just take opportunities without looking at the analytical part to see in the long term, the cost of maybe dealing with the solution would be higher than what we are getting now. So I agree that we need to pay much attention to that. The other thing I want to say about water and sanitation is the fact that you need to be able to reach out to whosoever you feel your government or maybe local representatives are that can help you, because just a small, let me take this. If you use just one small particle of an excreta from a human being, the amount of bacteria that is in that excreta is so much that you don't even want that small piece to go into your body. Now we have homeless around. You don't know where they go to defecate. Open defecation is a big issue that we are fighting or trying to combat in the whole world. And so when people are doing or they are staying outside and they are practicing open defecation, do not say this doesn't concern me. It doesn't concern you today because the person is shaming himself or herself because others are seeing them. But the consequence, you and I would all be part of it. One thing about water and sanitation is the problem is individual when the person has to use it. But we have a long-term community problem if we allow that person to go through that individual problem. So if you don't address the issue of open defecation within your community, I can tell you that you are bound for typhoid, you are bound for cholera, you are bound for any other thing that is related to parasitic infection and worms and viruses. The other thing is we need to support people at least externally outside the US. Sometimes some of the problems that we find in the US are probably not existing here, but somebody can bring it from another country. These days, it's not like the olden days where it took the ship maybe 4 months to move from Africa to the US, or maybe to move from Asia to the US. This time, it takes only 1 hour or 5 hours for somebody to move a disease from Africa to the US. So a problem that is experienced in India or maybe Ghana or Liberia or Cote d'Ivoire can be brought to the US within the shortest possible time. So we all have to act. We don't have to wait and say, this is not my problem. We have to know that the problem can be yours once it starts. It is no longer going to be that person who started it, but everybody. Thank you so much.
Yes, thank you so very much. Well, I think I will be closing on time with everyone. I want to respect everyone's time that they provided today. Duane, I'm going to go ahead and pass it back to you. We have received quite a bit of information and ways that we can strategically address some of these solutions, I think, locally and also just educating ourselves. So Duane, I'm going to bounce that back to you.
Thank you, Chris. Wow, that was really amazing. I'm really blown away. And you know, hearing a presentation certainly is different from seeing it in person, but this was really eye-opening. And you guys really shared some glaring issues that we should all be focused on addressing. You know, in doing our work here for 38 years, and to the question about, is this a problem in the US versus developing countries? It's definitely here in the US, and we have seen it personally through our work. When Habitat was formed, we started in 1983. We built a lot of houses out in Fayette County first before we came back into Shelby County. So in the rural area, we definitely saw that we were impacting women and people's health in general by just getting them decent, reasonable plumbing. And then here in the city proper, as we've started doing aging in place, we realize still that there are significant housing issues for the aging community. And, you know, driving down the street, you may not have any idea the condition that people are living in. And so as we go out and do the assessments, we make some real discoveries about the complexities and difficulties that our seniors are living through. I was really compelled with the myth of meritocracy and what that says about society. Also, the 13 years of additional life expectancy in our city in particular as we move eastward, which is from more of the poverty areas to affluence. And then just internationally speaking, and things that Dr. John shared, I've seen so much of that personally by traveling with my friend Susan Yao, who is over our Tide program. And I would say that being a housewife anywhere in the world is a very important job and role, but it's certainly different in the US and developed countries versus impoverished countries around the world. So can you imagine, you know, taking care of your family when you're having to walk 5 or 6 miles just to get clean water? And I know that all of you listening and watching probably don't take that you know that it's a serious situation because you're here and you want to have a positive impact on improving the lives of women and girls. And I thank you for participating, and we're going to continue to learn together. As my colleague Sherry Rout and I started talking about Women Build and how we wanted to approach it going forward. And as Jessica shared, the first thing we said is, you know, we're not going to raise money, we're going to raise awareness, and we're going to talk in depth about the issues that women and girls face around the world and here in the States. So thank you for being a part of this conversation. And Sherry, if you want to put your email in the chat box, I think that we'll probably build or create a Women Build committee here soon. Sherry can use help, ideas on other subject matter that we might want to discuss. And eventually we will, you know, focus on fundraising. But first, we're going to continue to talk about issues and opportunities to improve the lives of women and girls, especially as it pertains to decent housing. And so thank you again to Chris Reeder, to Dr. Hotz, and Dr. Akudago for those informative presentations. They were amazing. And before we close out, I've been asked to make sure that I encourage all of you to join us on Tuesday, May the 25th for our final webinar in a series with the Tennessee Human Rights Commission. And the final webinar is going to serve as a look back over the past year at the cumulative impact we've seen on fair housing as a result of the COVID-19 pandemic. And all of the details about that and other things that we're doing can be found on our website and on our social media and in emails if you sign up and register with us, and then we'll keep you informed about things that are going on. You can also watch for communications from us about future Women Build webinars and events. And I want to thank you again. Did I miss anything, guys? Chris? Anyone? If not, Chris, go ahead.
I was going to say, you covered absolutely everything. We've dropped a couple of things in the chat box so folks can refer to that.
Great. Again, thank you everyone for joining, for your interest in the issues, and to the doctors for sharing their insights with us.